Good evening, dear viewers, Ramadan Kareem, and welcome back to Health Watch. Tonight we're going to talk about important diseases that can affect mental health. We will talk about panic disorders and also anxiety disorders. And our guest tonight is Dr. Abdullah Gholoum. Welcome, Dr. Abdullah.
Hello, Dr. Michelle, and thank you for having me on the program.
Dr. Abdullah, would you like to introduce yourself to our viewers?
Well, yes, I'm a consultant psychiatrist at the Psychological Medicine Hospital, and I work there most of the time, and I also have a child clinic in Amiri Hospital once a week.
Thank you, Dr. Abdullah. Dear viewers, if you have any questions, don't hesitate. Our numbers will appear on the screen right now. Welcome back, dear viewers. I would like to remind you that our topic tonight will be about anxiety disorders, panic disorders, and our guest is Dr. Abdullah Gholoum. Dr. Abdullah, before we start talking about the different types of anxiety and panic disorders, can you tell us something about anxiety disorders? What is anxiety disorders?
Well, anxiety disorders is a group of disorders that basically the patients complain of apprehension and tension and fear. Okay, so that's what is common among all these disorders. Now, there is a difference between normal fear and anxiety.
Okay.
Normal fear can happen when someone is going for a job interview or someone going for an oral examination, and so they will have some anxiety about that specific situation. In that case, it's normal to have your heart pounding or, sweating or a bit trembling. But if these symptoms happen without a given situation, then we call them some sort of an anxiety disorder.
What are the common anxiety disorders? They are, as you mentioned, they are a different group of disorders. It's not one disorder, right?
Yes, it's a group of disorders. Actually, anxiety disorders are the commonest psychiatric illnesses. People, when you talk about psychiatry, they think about depression, they think about, sometimes schizophrenia. But the research shows that the commonest disorders among all psychiatric disorders are anxiety disorders. That's why, I chose to talk about them in our episode tonight. And I would like to show that
Okay, you have some slide to
if
show?
we have, just to introduce our viewers to the group of disorders, like you see, anxiety disorders, there is a group of disorders. There is panic disorder, agoraphobia, specific phobia, social phobia, obsessive compulsive disorder, and post-traumatic disorder. And each one of them we can talk for a long time, but really maybe I would like to stress on, panic disorder and obsessive compulsive disorder, but, it's also, if we have time, we can talk about other disorders as well.
Okay. Okay, and one of these are, what of these names is long post-traumatic disorder?
Yes.
Is it considered to be anxiety disorder?
It is classified as one of the anxiety disorders because it is basically what's the group of symptoms focus around, feeling tense, anxious, apprehension, and lack of concentration with, fear of the given situation. So it is classified as among the anxiety disorders.
Okay, so let's go with the panic disorder as the most common one.
Yeah, actually the most common of all these disorders is specific phobias.
Okay, do you want to start with that or go with the symbol with the panic disorders?
Okay, I can talk about panic disorder, but I just want to mention that specific phobias are the commonest psychiatric disorders. but they go unrecognized. You can say most of these disorders are hidden. The patient will be suffering from them, but it doesn't look, it doesn't appear, it doesn't show on the patient. I mean, patients who are depressed, it shows on them that they are depressed, they are isolated, they are, not functioning properly. Patients who are having mood problems or, problems with their thinking, it shows in their speech, it shows in their behavior. But these patients don't have any, obvious manifestations of the disorder. So they are suffering inside, but people don't know that they are suffering. So people with phobia...
Yeah. Let's start with this one, because one of the reasons for our program Health Watch is, to help people and our viewers to recognize things that usually nobody recognizes them.
Yes.
Let's talk about, because this is interesting, because how they discover this condition, why it's now recognized more than before.
Yes. Well, there is more now awareness about mental health and psychological health. Before people focus on physical health as if this is the most important aspect of our life. But people are getting to realize that, mental health is as important or equally important like physical health. So now people are really aware psychologically, and they read, books about psychology, they listen to programs about mental health. So there is more, and there is the internet, there is the, satellite programs. All of this is making people more aware about psychological health. So people are becoming more aware, and they are, they learn more and they ask more questions about these conditions.
Now we'd like to know what causes anxiety disorders. Why it happens? Okay.
There are two basic assumptions or theories. First of all, there is a strong genetic component. Okay. And many people, when I tell them, they say, psychological, it should be, how can I inherit something psychological?
Yeah, people think from past experience, how they
people always associate that, this is something happened to me. But no, there is strong evidence, actually, among all psychiatric disorders, one of the strongest etiological reasons or, factors that cause a transmission of an illness is genetic factors. So if your father had an anxiety disorder, like a panic disorder or phobia, you are likely, or his offspring's children, they have a higher risk of getting this disease than other people whose parents don't have this disorder. So there is a genetic component.
Okay.
The other component is the biological component, and this has to do with the brain function itself. Now, it's a little bit complicated, but I will try to say that there are certain transmitters. These are substances within our brain that regulate our emotions, our sleep, our memory, and these transmitters, when they are disturbed, they cause the anxiety disorders.
And this can apply also for other...
and applies for depression, applies for schizophrenia. Okay. So in anxiety, I tell to my patients that there are many neurotransmitters, but the most important one is serotonin. Serotonin. It's called serotonin, just for people who want to know more about it. So when there is an imbalance about this neurotransmitter, there is a constellation of symptoms that lead to these disorders.
What about past experience? I have lots of my patients, when they come for alopecia, we think it's, which means hair loss, acquired disease, and they're related to stress. And they try to relate things like, he was scared by a cat, he saw a horrific accident in front of him, and since that period he started to become anxious, upset. Can these things show up, these anxiety disorders?
Yes, it can. So if we go now to panic disorder.
Okay.
A panic disorder can happen out of the blue, or it can happen after, like you mentioned, a car accident. Okay, suppose someone is driving along the road and he saw a really bad car accident, and then he starts having the let's talk about the symptoms of panic disorder.
Okay, we have a slide to show, yes.
Yes. So panic attack is an attack by its own. If it becomes repeated, then it becomes a panic disorder.
Oh.
I mean, panic attack can come once and never come back.
Okay.
We don't call it panic disorder.
Will it come regularly?
When it becomes recurrent, then we call it a panic disorder.
How often? Once per week, once per month?
If it becomes 4 times a month,
okay,
then it's and the patient then start anticipating, oh, I'm going to have an anxiety attack, and they do have an anxiety attack, a panic attack, then it becomes a panic disorder.
Okay.
Recurrence is the key. When the panic attack recurs, then it becomes a disorder. If it happens once, we don't call it a panic disorder.
And this includes palpitation.
So basically what happens is, when someone is scared, what happens to them? Their heart, start pounding, so they have palpitations. They start sweating, whether the forehead or the hands. They start trembling and shaking. They will have shortness of breath, difficulty breathing. They might have chest pain. Okay, they might have some nausea, or they're feeling some butterflies in their stomach. They're feeling dizzy or lightheaded. It is common.
Can they fall down?
No, the thing is they never fall down.
Oh, okay.
They feel lightheaded, they feel dizzy, and I tell this to my patients. They are really afraid of falling down. They are worried that they might throw up or vomit. But I tell them, you never vomit, you never fall down.
Okay.
It's a sensation. They feel that they are going to vomit. They feel that they are going to fall down, but they don't. They feel that they might just lose control, scream. They feel that they are going crazy. They feel that they are going to die. They also feel some kind of numbness in their fingertips, or in their shoulder, or on their skin, and there is also hot flushes. So these are the symptoms that happen in a panic attack.
I realize from what you mentioned is that from the history you can realize most of the things about these conditions, and you can rule out things like you mentioned. If they didn't had history of falling, no history of vomiting, this is very important negative signs, right?
Patients feel that they are going to have a heart attack, or they are going to have even a brain hemorrhage, or not a brain hemorrhage, a brain infarction, or but that this is the panic attack has 2 components: the physiological, which we are mentioning,
exactly,
and some of them are the psychological, which fear of dying, fear of going crazy, fear of losing control. This is